You're listening to Health Professional Radio. My name is Wayne Bucklar, and today my guest joins me from Sydney, Australia. It is Grainne O'Loughlin, who is the CEO of Grainne. Now, first of all, I've just been told Grainne is not French, it's Irish, and Grainne's not a mistake, it's New Zealand. So, welcome to the program, Grainne.
Thank you very much. It's lovely to join you today.
Now, I have to admit, Grainne, when from first I saw the name, I thought, what on earth? So do tell us two things, what it is you do, because it's not obvious from the name, and where did that name come from?
Sure. Well, I might start whereabouts the name comes from. So the name originated from New Zealand, and our founder was a Mr. Truby King, and he founded what was known back then in 1923 as the Australian Mothercraft Society, opening the first baby clinic in Elizabeth Street in Sydney in 1923. So we are all about improving the lives of children and families, and so we intervene with parents and children from the ages of 0 to 5 years, helping people through that challenging but very rewarding stage of parenting.
I see. And in New South Wales is where you are currently. Is it a New South Wales only organisation?
That's right. Look, we are a New South Wales-based service, and we provide actually a range of services, and some of them are statewide, and some of them are aligned with our local health district areas. So we have centres at Randwick in the eastern suburbs, and also centres out in southwestern Sydney based at Fairfield, Carramar and Camden sites.
And I agree with you when you say it's a challenging but rewarding time for parents. Fortunately, my years as a parent are many years behind me. But way back then, when I had little children, there were a lot of government-provided services who, I think they were called maternal and child welfare clinics back in the day. But that's in a different state as well. Is that sort of service still available, or is that now largely the work that you do?
Look, I think it's really along a continuum of care. So there certainly are frontline government-funded services for parenting through our early childhood centres and child and family health nurses, and people will often see their GPs or their early childhood nurses. And I suppose we get to see families and parents when difficulties have become a little more challenging, and they've tried a few tried and trusted ways to resolve issues. So it's really for us about more complex, so it might be sleeping and settling and breastfeeding issues with their infants, or in fact it might be around mums or dads experiencing perinatal mood disorders such as anxiety and depression, or it might be toddler behaviour, very difficult toddler behaviours that may manifest in the early years, and people are really looking for some expertise and advice on how to manage that side of things as well.
And parents of toddlers do have my absolute sympathy. The terrible twos are not misnamed. Grainne, many of our listeners are clinicians of one kind or another, mainly either in acute care or in aged care. Now, I guess you don't have much reach into aged care, perhaps with grandparents, but with acute care we have doctors, nurses, allied health professionals. Is there a takeaway message for them today as a result of having heard you on Health Professional Radio?
Well, look, I guess it's just the fact that we also are a multidisciplinary team of healthcare professionals. So we have child and family health nurses, we have perinatal nurses, psychologists, clinical psychologists, psychiatrists and social workers. We are a health-based facility, and so I think it's important for people to know that there is a secondary and tertiary layer of professionals that can help. We've got a care line and an advice line that parents and or health care professionals can call us on. And so we are a point of contact in that continuum. And our work is often very much in partnership with the healthcare professionals from other organisations and both government and non-government organisations. So it's a bit about the team. The family and the child are in the middle. That's where the focus of our attention is. But often we do rely on that network of healthcare providers to come together to get a full picture of what may be happening for a family at that given time.
And do people need a referral to you? Like if I want one of my patients to make contact with you, does that need to be done through a referral, or can they just give you a call, or how does that work?
Yes, so we do accept online referrals from GPs and healthcare professionals, and we have a website which has got an online referral if people want us to look us up. But also we do have parents that ring into our care line service, and if they're describing their situation and we believe that that they could benefit from some of our services, we do often prompt them to see their early childhood nurse or their GP to seek that referral to our service.
Now, let's give that website a mention since we just mentioned it before. This is karitane.com.au. So it's www.karitane.com.au.
That's correct.
And Grainne, what number? You mentioned a phone number there. Do you want to add that in as well?
Yes, so our care line number is 1300 227 464. And that's open 7 days, and it's manned by child and family health nurses who are available for consultation on a wide range of non-urgent inquiries concerning their children from the 0 to 5 years of age.
Now, Grainne, my favourite question in every interview is about misconceptions. It must be a sign of the perversity of my personality, I think. What's the biggest misconception in your work that drives you nuts and keeps you awake at night?
Look, I suppose for me it's about the recognition of the diversity of the families that we support. And, some people from time to time have a fairly narrow view that we're supporting what they would refer to as the worried well. Mm-hmm. But I think what's important is that we support families who really, in that early intervention prevention phase, where it's been shown that there's significant research and global evidence that those models of care are very impactful to ensure attachment with parents and children. And the research shows that if you don't have that attachment early on, that can impact the child's behaviour and the child's outcomes as they grow up. So it's not just about people who haven't had a good night's sleep. This is about people who are really struggling at that stage, and it's the single most important thing in their lives is to be able to care for their child and care for themselves. So we have children that we see and families in foster care situations, in juvenile justice programs, in teenage pregnancy programs. We see families that have arrived through terribly traumatic experiences through asylum seekers or refugees and new migrants whose children have, seen some very traumatic events, and parents may have had some very traumatic journeys. So I guess it's about recognising that Karitane cares and supports these families and parents from very diverse backgrounds, and to diminish that sense that it's worried well people that are seeking our assistance. I suppose that would be the message that I'd like to get through.
And let's hope today that we've dispelled a little bit of that misconception and got a little bit of that message through for you.
Thank you.
Grainne O'Loughlin, CEO of Karitane, thank you for your time today. It's been a pleasure having you on Health Professional Radio with us.
Thank you very much, Wayne. Lovely to talk to you. Thank you.
Now, if you've missed some of those references and you'd like to get in touch with Karitane, the website again was www.karitane, karitane.com.au, or the care line number is 1300 227 464. If you've missed my conversation with Grainne altogether, then we've got a transcript on our website. You can also listen to an archive audio of the conversation, both on YouTube and SoundCloud, and you can access all of those resources through the Health Professional Radio website at www.hpr.fm. This is Health Professional Radio, and you're listening to Wayne Bucklar. Thank you for being with us today.